Hi everyone, I'm Bronwyn Fitz. I'm an integrative gynecologist and functional medicine doctor. Today I want to talk about Polycystic Ovarian Syndrome, or PCOS as it's known. I have a lot of women in my practice who suffer from PCOS, and they are coming to me because they want to explore other options as opposed to just traditional birth control pills and infertility medicines and things like that. So we do have a lot to offer, and I want to review some of those things in today's video. But first, just to backtrack a little bit, if you're not familiar with PCOS, there's three main hallmarks of the syndrome. One is irregular periods, usually skipped periods, excess androgen symptoms, and so what that means is increased male hormones like testosterone, which can cause things like acne and male pattern hair growth. So women are plucking coarse hairs from their chin, or they notice thinning in the hair on the top of their head. And then the third hallmark are, there's a characteristic finding we see on ultrasound. When we look at your ovaries, there's often very small, underdeveloped ovarian cysts that are all the same size. So we see that in people who are not having regular ovulatory menstrual cycles. So in traditional medicine, as a gynecologist, I was taught that when someone presents with PCOS, the first line therapy, if you're not trying to get pregnant, is to go on the birth control pill. So the birth control pill, it does a lot to address many of the symptoms of PCOS. It regulates your period. It's going to decrease free circulating testosterone, which helps a great deal with acne for many women. It protects the uterine lining long term from overstimulation, which is important in the long term for people with PCOS and other people who aren't getting regular periods. You want to balance the estrogen and progesterone to decrease risk of uterine cancer. And of course, birth control pills offer contraception for women who are sexually active, which is extremely important. But for women who are young, I have a lot of patients who are really young and they're not sexually active, and their moms bring them in actually because they feel a little bit hesitant about putting their young teenage daughter on birth control pills if she doesn't need contraception. So, and there are other medicines that we use to help with acne, things like spironolactone, and metformin, which is an insulin sensitizer. So it's interesting, it turns out that one of the underlying drivers of PCOS is probably insulin resistance. Now, I'm going to back up and say we haven't fully worked out the mechanism, like what's going on with PCOS, what exactly is causing it, and we haven't figured it out yet. So a lot of research has to be done still. We do know that PCOS actually can manifest differently in different people, and women can look very different. So not everybody has those, polycystic ovaries. Not everybody has elevated testosterone. Some women have struggle with being overweight, and the weight is certainly a component and a driving factor in what's going on in their missed periods. Other women don't. Other women are very thin. So there's a great variety of ways that women can look when they have PCOS. I feel strongly there's got to be a genetic component, but genetics aren't everything. It's genetics plus lifestyle and environmental influences that drive our genetic expression. So anyway, there's a lot that we need to learn about PCOS still. The insulin resistance, I think, is a key component for many women. Interestingly, it's not even included in any of the diagnostic, criteria for PCOS. But we know that insulin acts in every, tissue in your body, basically, and including your ovary. And there's an interplay between insulin and glucose and testosterone, which then converts to estrogen. So it's this whole sort of hormonal orchestra that's going on. So when we put people on the birth control pill, we're addressing some of the hormonal issues, but we're not addressing the metabolic issues, the insulin resistance. And so that's one reason why I worry a little bit about women who go to a doctor and they just say, oh, you've got PCOS, here's your birth control pill, I'll see you in 10 years. When you want to get pregnant, these women come off the birth control pill, and they're not getting regular periods. And metabolically, there's kind of a lot of disruption going on still. And now the clock is ticking and they want to start their family and they're not having regular periods. And And so now they're doing the hard work of trying to figure out, the root of their infertility. So what I like to do with women who have PCOS is I always try to figure out, first of all, what your most worrisome symptoms are. What are your immediate goals, long-term goals? We have to get women symptom relief for sure. Acne can be very distressing to anybody, but to teens for sure. There's also studies showing that women with PCOS suffer from higher rates of anxiety and depression. So whether that's a result of, the stress they're feeling over their health or, the hormonal metabolic changes impacting their mood, it's probably everything. It's very important that we address women's goals, their symptoms, try to get them feeling better. So what I tell women is there are ways to do this without necessarily reflexively going on the birth control pill. So food is medicine, right? So therapeutic foods for insulin resistance and PCOS are going to be things like flax seeds, organic whole soy products, green tea, cinnamon, really important. There are some great supplements that have more and more research supporting their efficacy in PCOS, things like inositol. And there's different kinds of inositol. There's myo and D-chiro-inositol, and there's probably an optimal ratio that we're going to try to give to people. There's a lot of research going on that right now. Other supplements I think of are N-acetylcysteine, chromium, certain herbs are helpful. Chasteberry for sure to help support progesterone, balance estrogen and progesterone. Curcumin, green tea, licorice. There's quite a few. So when I'm working with people, I tailor every treatment plan to the person. I could never just go out there and say, okay, here's the protocol. Take this, 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 and this. Everything has to be kind of put together within the context of what's going on in the life of that patient. I always ask, how you're sleeping, how's your stress level, what's the family environment like, how's school going, all of those things play in. And stress management, if you've seen any of my videos, you know that I'm really big about stress management, which is always going to be impacting your menstrual cycles. So, for women with PCOS, the main thing that I like to tell people is there are lots of medicines to help, but there are lots of diet and lifestyle changes as well that we can work on. I usually suggest a team approach. I often, when we're talking about big lifestyle changes, I, try to recruit team members to help me, people like nutritionists and Chinese medicine and acupuncture practitioners, health coaches. I do work with and I refer patients to endocrinologists and infertility specialists. I think it's important that everyone on the team is communicating. I think people are going to get the best response that way. So that's just a quick overview about PCOS and some of the ways that I address it with my patients. If you're interested in learning more, give me a call or check out my website, women'sintegrativehealth.com. The phone number is 203-900-4194. And if you live in New York or Connecticut, I'd love to have a consultation. If you live outside of New York and Connecticut, we can do an educational consultation. And I hope this video is helpful, and have a great day.